Hello my YouTube fam. Welcome back for part 2 of my back surgery. That's right, surgery. As I said yesterday, that is a cross between surgery, sojourn, and journey. So back surgery. What I have to tell you today is how we go about repairing an issue with a lower lumbar spondylolisthesis and also spinal stenosis. I have to have a procedure that is called a laminectomy with fusion. There you see it, laminectomy with fusion. And it is a procedure to remove bony pressure on the spinal canal and spinal nerves to relieve buttock, hip, and leg pain. Occasionally, disc material needs to be removed as well. If there is an instability of your spine, you may require a posterior fusion of the spine. Well, unfortunately, I do have to have both procedures. I have to have the laminectomy and also the fusion. What was supposed to happen at first was just a laminectomy. When we looked at my MRI, my doctor thought, well, it's just spinal stenosis, and he could do a simple laminectomy, which probably would have taken about an hour and just been a serious but simple procedure. However, after further review of my x-rays, the doctor found that I have a disc that is slipping forward and falling onto the discs below it, which is called spondylolisthesis, which we discussed yesterday. And so therefore I have to also have the fusion. The fusion, the good news about that is they do have to take bone from another area of your body. Okay, that's not good news, but what is the good news about it is, since I am getting bone shaved from my spinal canal in the first place, they're going to be able to use that bone. Had that not been the case, they would have had to go into my hip and remove some bone from my hip, pulverize it, and use it to stabilize my spine. So the doctor is going to be using the bony fragments from my spinal canal, and those will be pulverized and used to stabilize my back, along with 2 screws that will be going in between my L4 and L3 vertebrae. I know this sounds painful and I'm pretty sure, you know, once I wake up it's probably going to be pretty painful, but I am definitely going to keep you guys abreast of what's going on. I'm going to be showing you a few more pictures here of the screws actually in place after a spinal fusion. There we have it. And also a picture of an actual laminectomy. And as you can see, the picture on the left shows the pinched nerve, and on the right the bone has been shaved away and the nerve is no longer pinched. And actually, to pulverize the bone, here are some pictures of that. If you're squeamish, please do not look at it. So I did try to get as much information as I could from my doctor as far as the procedure that I'll be going through. It is a 3-hour long procedure. I am still awaiting a phone call to find out what time the procedure starts. on Monday morning, February 8th. I still do not have that information. I will definitely get that to you as soon as I get it. I'm just going to take another look at some other pictures that I found of a lumbar laminectomy and fusion. My understanding is that I will be up after the surgery and able to walk with minimal pain other than from the incision. There are chances of complications such as infection or paralysis, but those are very slim. The procedure of the laminectomy involves taking either the bone graft, like I was stating before, from your pelvis or spine. They can also use synthetic bone graft and packing it around the spine to create a solid bony fusion across the unstable segments of the vertebrae. Usually, titanium screws and rods are placed in to increase the stability. Sometimes the lumbar disc is removed and replaced with a plastic cage filled with bone graft. We won't be taking that route. They are going to be able to use my actual vertebrae and put it back into its place and basically cement it with the titanium screw and the bone grafts. My doctor has told me that there is a 90% chance of a full recovery, and I am very excited about that. Based on where my pain is located, as I was telling you yesterday, 95% of my pain is in my butt cheeks and down my legs. My doctor told me that if that were not the case, if the pain was mainly coming from my back, then the odds of the surgery going well and fixing the problem would drop significantly, down to about 60 to 65% success rate. So I was very thankful that, you know, although it's a pain in the butt, literally, no pun intended, although it is a pain in the butt, it's a good thing it is a pain in the butt. That way I have a higher chance of a success rate. So guys, I'm going to show you a picture here of the hospital that I will be in. That is located in Pittsburgh, Pennsylvania. And I would like to close here and thank you very much for joining me again. If I have any other information before my surgery to pass on to you, I will be doing that by way of video. Also keep watch on my community tab because I will be throwing some information on there for you as well. I will also have some mukbangs for you that have been pre-recorded, so we won't be apart too long. But like I said, thanks again guys for joining me. I hope this was informative for you, and please stay tuned. We will have some mukbangs coming up. I will see you soon, YouTube fam.